Hello, my name is Tara O'Leary and I'm one of the physiotherapists at the Great Western Hospital. In this video I'm going to be talking to you about carpal tunnel syndrome, what it is, who might get it and how we might treat it.
And now we're going to talk about the anatomy. So the nerves that supply the sensation in your hand run from the spinal cord in your neck, down your arms and into the hands. One of these nerves, the median nerve, supplies sensation to the thumb, index, middle and ring fingers. It also supplies the muscles in the palm and the base of the thumb. At the wrist, this nerve passes through a tunnel formed by the wrist bones and a band of tissue called the transverse carpal ligament. Sometimes people develop inflammation in this tunnel, which compresses the median nerve and can produce symptoms in the areas supplied by it. So who gets carpal tunnel syndrome? We don't always know why some people develop it, but some are more genetically predisposed to it, or it may follow a wrist fracture or injury. However, you are also at increased risk of developing carpal tunnel syndrome if you have certain conditions, including hypothyroidism, obesity, rheumatoid arthritis, or diabetes. It also commonly develops during pregnancy, where it often resolves on its own after delivery. Carpal tunnel syndrome is also associated with repetitive movements of the wrist, or having the wrist in a bent position for long periods of time, for example, like when you're asleep.
So what are the symptoms of carpal tunnel syndrome? The main early symptom is pins and needles or tingling in your thumb and fingers, usually with the exception of the little finger. These often come on overnight, can be settled by shaking your hands out, and are not usually present during the daytime. In more severe cases, or as time goes on, you may start to notice daytime symptoms, or have pain and muscle cramps, and notice less strength and coordination in your hands, and less feeling in your fingers. If you've had the symptoms for a while, you may even notice some wasting of the muscles in your hands.
So how do we treat carpal tunnel syndrome? Treatment is aimed at reducing the inflammation in the carpal tunnel and allowing time for the nerve to heal. Avoiding the activities that provoke your pain and symptoms is the first part of treatment. So this might be typing, driving, holding a book, or heavy gripping, for example. If you have to do these activities, taking regular breaks throughout is helpful. We will also provide you with a wrist splint. This can be worn through the night and also through the day if you're experiencing daytime symptoms. The wrist splint helps keep the wrist in a neutral position, which reduces the pressure on the carpal tunnel and allows it to rest and heal. For mild symptoms, this treatment is often enough to resolve the problem in about 6 weeks. We recommend that you perform the exercises at the end of this video to help improve circulation, which may help the nerve to heal, and also to improve wrist strength and flexibility, which may help the condition stop from recurring. If there is an underlying cause contributing to your carpal tunnel syndrome, such as thyroid disease or diabetes, it is also important to get this condition treated. If symptoms don't improve with the treatment explained, your therapist may suggest that further tests are carried out to check the function of the nerves and to identify exactly where the compression is occurring. A steroid injection may be recommended if diagnosis is not clear, and in some cases people are referred for surgery where the carpal tunnel ligament is cut to release the pressure on the nerve.
So each of the following exercises should be performed regularly. Try starting with 3 sets of 10 repetitions of each, but be guided by your symptoms. Do not push into pain or do so many that you aggravate your symptoms. You can always start with fewer repetitions and gradually increase.
This exercise helps if you have limited movement in your wrist or pain. You just let your fingers naturally cascade down towards the ground in this position, and then bend your wrist backwards and find the fingers will curl towards the palm. And just keep alternating between the two. The The next exercise helps the tendons glide freely in your hand and wrist. Start with your elbow resting on a table and your fingers pointing towards the ceiling. Then curl the tips of your fingers down, keeping the large knuckles straight so you form a hook grip. From this position, bend the large knuckles and straighten the fingers to come into this position. And now bend the fingers down so that the tips point towards the table. And finally, curl your fingers up to make a full fist. And then repeat. The next exercise helps improve your grip strength. So if you have a ball or a piece of sponge, grip it in your hand, squeeze as hard as you can, hold it for 3 seconds, and then release. And repeat this. The next exercise will help you improve your wrist range of movement. So support your arm on a table or the arm of a chair. Let your wrist hang down over the edge, and then use your other hand just to gently increase the stretch. I want you to hold this for 20 seconds and then relax. That can be repeated 3 times. And then also perform the exercise in the opposite direction, bending your wrist upwards and using your unaffected hand to increase the stretch. Again, hold for 20 seconds and repeat 3 times. The next exercise is designed to help improve your wrist strength. If you take your affected hand and pop it on the table and place your other hand across it at 90 degrees, I'd like you then to try and lift your lower hand whilst pressing down with your upper hand. You should feel the muscles in both your forearms start to work. Hold for 5 seconds and then relax. Then swap your hands over and repeat in the opposite direction. This exercise helps the median nerve glide freely through the wrist. You start with a closed fist, then straighten your fingers, then bend your wrist backwards. Then take your thumb away from your fingers. Then turn your hand away so your fingers point forwards. And then use your other hand to gently increase the stretch on your thumb. And then return to the starting position. If you have problems with your neck, you can also try the next exercise, which glides the nerve along its whole course. The exercises in this video are in the links below. If you have any problems, do consult your physiotherapist, and thank you for watching.